Welcome to all. My name is Dr. Chakradhar, consultant neurologist at Renova Hospital, Sanat Nagar. Today we will discuss about headache, which is the most common symptom with patients who come to our OPD. Headache is nothing but some sensation of a pain which is perceived over the head region. This can be from several causes. Most of the common cause is what we call as migraine, which is the primary cause, primary headache. That is, there is no identifiable cause of this. Other primary headaches are tension type of headache and cluster myalgias and cluster headaches are these symptoms. Apart from that, there are secondary causes of headache. That is, in case of a brain infection or hemorrhage in the brain or any kind of injury to the brain can also present with the headache. So primarily we will discuss about the migraine because it is the most common symptom, common reason for the headache. The migraine, in migraine there are several types. However, the commonest type is one starts feeling the headache on one side of the head, which will be throbbing type. Usually, this will be in the throbbing or pulsatile nature associated with nausea, vomitings, and photophobia. That is, they whenever they see the light, they feel irritated, and phonophobia, and that is when they hear some sounds during the headache period. They also feel irritated, and these kind of headaches usually last with from minimum about 4 hours to maximum about 72 hours also this can persist. However, there are several variations from person to person how these manifestations, and in few other classic type of headaches what migraine, they can also have auras. That is, before the onset of headache they can feel that seeing some weird kind of lights or circles in front, and subsequently they start developing the headache. Now, even other symptoms such as along with the headache, they can also feel giddiness or vertigo or some kind of sensations in the body or weakness or a part of the body can also be other rare manifestations in case of migraine. However, with these symptoms, once anyone comes to our clinic, we uh, take a detailed history. That is, how is the manifestations and how are these associated with his daily activities, and when it is precipitating, we need to evaluate because there is no proper diagnostic test. That is, migraine cannot be diagnosed with an MRI or a CT or any other investigations. It is purely a clinical diagnosis. That it depends upon the history and the response to the drugs. We can diagnose the migraine. So this becomes important to provide a proper history. And in case of what are the causes that triggers these migraines are mainly the stress is one factor, and in other factors that can vary from person to person is some sort of smells or some kind of foods, and very long exposure to the screen time or eye strains can also trigger. Some rare causes are back neck pains and sinusitis. Any tooth pain also can trigger these migrainous headaches. Now, coming to how one should get treated with this is there are several medications associated with this for treatment of this condition, and also for the prevention. Initially, it can be sometimes it can be straightforward diagnosis. However, in case of any doubtful uh, patients or doubtful scenarios, we may get some CT scan or MRI just to rule out other causes, as I previously told, and then confirm to so that we can be sure about the migraine in few patients. Now, the migrainous management depends upon age of onset as well as the gender. That is, in certain females, we can't use certain drugs. We should be avoided. In case of obesity, patients with obesity also one needs to avoid certain drugs. These are the factors we consider, and we use them. Along with this, one has to manage the lifestyle because at most of the about half of the attacks can also be prevented by proper adequate healthy lifestyles. That is, one need to have proper rest and which is sleep deprivation should be avoided, which is the most important cause of trigger for migraine, as well as proper food timings and regular exercises and healthy habits should be undertaken to prevent the migrainous episodes. Okay, thank you. Please like, share, subscribe Health Focus All channel.